My name is Patrick Barkey. I direct the Bureau of Business and Economic Research at the University of Montana. It's been my honor to serve as president of AUBER, the Association for University Business and Economic Research, and to introduce this program. AUBER is a professional organization of university-based and other regional economic centers across the U.S. We've been presenting these online roundtables over the last several weeks as a way of delivering the content and value that our in-person fall conferences normally provide. We've discovered along the way that this format gives us an opportunity to introduce our organization and our activities to a broader audience. So I invite you to visit our website, auber.org, if you'd like to get in touch or learn more about us. Today's roundtable showcases some of the excellent, timely research AUBER centers are involved in. Research that's relevant and valuable to policymakers at the state and regional level. Before we begin, I'd like to also give a little plug for our next roundtable, which I see has not been scheduled on an exact date, but that will be coming next month. And that'll be an excellent program that features a number of directors from different states across the country talking about what the rebound looks in their individual states and regions. So let me begin by introducing the moderator of our program. Mike Hicks is the George and Francis Ball Distinguished Professor of Economics at Ball State University in Muncie, Indiana. He'll moderate our program and introduce our presenters. Mike directs the Center for Business and Economic Research at Ball State and has served as an AUBER officer for 3 years. Welcome, Mike. The program is yours.
Thanks, Pat. It's good to be with you. Welcome, attendees. We have a really interesting pair of discussions today covering stay-in-place orders and social distancing behavior throughout COVID with two of my colleagues here at Ball State University, Srikant Devaraj, who's a research assistant professor at the Center for Business and Economic Research, and Erik Nesson, who's an associate professor at the Department of Economics and NBER. And we're going to start with Srikant's discussion. He's going to go for about 20 minutes. If you have questions, just go ahead and tap them into our chat room, and I'll be asking a few questions of him, and then we'll be followed by Erik. So with no further ado, I'd like to present Srikant Devaraj at Ball State University.
Hello. So today I'll be presenting about the effectiveness of stay-in-place orders during COVID-19 pandemic and evidence from the US border counties. So this is a working paper, and my co-author from Pankaj Patel from Villanova University. And in this particular paper, we actually are trying to see whether the stay-at-home order policies that were in place between March and April, how effective were they, and what are the effect sizes of those in terms of the COVID-19 incidence levels. So let me start off by showing the incidence rates by state. This is taken from CDC a couple of days back, and you can see the number of cases reported per 100,000 population across all states in the US. You can see there is a wide variation of incidence rates across the states. Highly dense populated states have higher rates in here. And you can also see in this slide, which was taken recently, here we see the trends in these incidence rates. These are weekly reported rates. The trends starting from March 1st to July 19th. You can see most of the states, especially we call that as wave 1 of COVID-19. After that, there was a little bit of flattening of the curve, possibly due to social distancing measures like stay-in-place orders that were in place across most of the states. And then, say in wave 2, the cases have been rising, either due to the partial reopening or lower social distancing measures as well. And this is evident across almost all the states in the US. And you can see the brown highlighted states are the states where you have cases that have been rising over the past 2 weeks. So there is also enough variation among the trends as well. When we look at the death rates, it is also consistent to the incidence rates as well. There is a huge variation across states in terms of the death rates as well. So as I mentioned, as a part of the social distancing measures, states have implemented the stay-at-home policies, stay-in-place orders, and there is almost 42 states and Washington, D.C. had implemented the stay-in-place orders in order to increase social distancing measures. And about 8 states had no stay-in-place orders. 3 states, to be specific, they had only partial orders, not the entire statewide orders were not in place. Only a few counties in those states had stay-at-home orders. And this is between March 19th, that's when California started their stay-at-home order policy, and through April 7th, which is where that's the time when South Carolina had actually placed the implemented stay-at-home policies. Now, there are several studies that exist right now. Most of them are working papers as well. They look at the state level incidence rates. The first study is Dave et al. They use a cumulative distribution of cases, and they found that the cases fell 44% 3 weeks after the implementation of stay-at-home policies. A couple of studies find no evidence of case decline. A study by Sidner and their team, they find using interrupted time series data, they find a decline in growth rates of about 0.8% 4 days after the implementation of stay-at-home policies. And using synthetic control method, Friedson also find evidence of 125 to 219 cases per decline in per 100,000 population. And there are some studies at a county level that is that's an ongoing research as well. So Dave's group find a decline of 19 to 26% in daily growth in Texas counties. Cotamanch and group, they find a daily growth rate declines of about 5.4 to 9.1 percentage points between various cutoffs after the stay-at-home policies were implemented. And Liu and Wegby find using 2 states, Iowa and Illinois, looking at a couple of border counties, a few border counties, and they also find decline in reduction of cases. So the literature behind this particular topic, you see evidence of some mixed response, varying effect sizes, and they are focused mostly on the state level and county levels, and even highly population density counties as well. So going back to the screen in terms of the stay-at-home policy orders, we contribute in terms of the methodology or in terms of the empirical strategy is slightly different from what has been done before in this particular topic. So we take counties from the southern, Midwest, and mountain regions where stay-at-home orders were implemented. And we also find a control group of those counties among states who did not pass the stay-at-home policies. So our empirical model looks like this. So you can see the brown colored counties are the border counties from stay-at-home ordered states, and the gray counties represent the corresponding neighbor of the adjacent state where stay-at-home policies were not passed. So this particular design is going to help us to control for any spatial heterogeneity across border counties. So that's the contribution we make in this particular literature. So as we see, we have about close to I would say close to 180 match pair counties where we match one county within the state of stay-in-place order county with a non-stay-in-place order county. And that's how our empirical strategy is going to work. And the data comes from publicly available sources. The incidence rates come from USA Facts. We find the effective dates, which is varying across all the states from the New York Times portal. And we also add a lot of control variables from the prior controls, such as economic, demographic, and health variables from various publicly available sources. And we use a timeline of March 1st to April 25th. After April 25th, some of the states reopened, so we didn't want to bias our estimates based on that. So we limited our analysis across these timeframe. And we, as I said, we created about 182 county pairs, and this analysis is done at a daily level. And we have about 15,000 county observations. And our model is in line with a few studies that uses this spatial heterogeneity design. And that's in equation 1, where we control for this match pair county fixed effects. So this technically takes care of any potential spillovers that happens across state borders between neighboring counties. And we also include day fixed effects, which actually controls for any fluid situation that actually happens on a daily level, even at a national or local press conferences that could potentially lead to change in the social distancing or voluntary isolation that could bias our estimates too. So we were able to capture those through those day fixed effects. And we use our standard methodology in clustering our standard errors. And we also try to differentiate the cutoffs after the stay-at-home policies were implemented. And we use the cutoff that is there in the current literature, which is 1 to 5 days past the stay-at-home order, 6 to 10 days, 11 to 15 days, 16 to 20 days, and 21 days after the stay-at-home order were implemented. So these are the two specifications we are going to test. So before we begin the testing, we first of all start off with an event study. And this is trying to see whether whether there are any pre-existing trends in the cumulative incidence rates across states. And we start off by using this pre-implementation of order. In this case, we have taken 2 different settings for the event study, one having 1 to 12 days before the stay-at-home order as a reference, and then we go 1 to 5 days before stay-at-home as reference as well. That's the right-hand side table. So what evidence this tells us is at least before the stay-at-home orders were passed, we appear not to see any pre-existing trends in here. And any reduction in the incidence rates have happened after the order were implemented. So once we tested for these pre-existing trends, then we run some descriptives. So these are the list of variables that we use in our models. So it's a combination of demographic models, it's a combination of economic characteristics and also health characteristics, the prior health characteristics, which could be a confounding factor for the evidence of increase in incidence rate. So we try to control for that overall as well. And we do compare this between the stay-at-home state and the non-stay-at-home state as well. Here are the preliminary results of our study. So what we find here, so there are 4 models listed here. The first model is a base model without any regional controls. And then we use like a stepwise model where preferred model is going to be model 4, where we include all our controls. And what we find is stay-at-home orders, in fact, have reduced the daily growth rate, and the rate is about 2% decline, 2 percentage point decline compared to those counties or the match pair counties that did not pass the stay-at-home orders. So this is our overall finding in terms of the effectiveness of stay-at-home policies here. And when we break this down into these different cutoffs, what we find is the stay-at-home policies did not affect in the initial 1 to 4 days after the implementation. The effects started to show only after the 6th day. So 6 to 10 days after this implementation was passed, we see a strong statistical evidence of declining growth rates of COVID-19 incidents. And that daily growth rate kept declining even 21 days after the policy was implemented here. We do several robustness tests we changed the modeling start date and the end date to go before March 1st to Feb 15th. We changed that to March 15th. We changed that way back to Jan 22nd. That's when our first data was collected. So those are the first 4 models with varying start dates. We still find our effects consistent. And models 5 and 6 calls for a different outcome variable. So earlier our outcome variable was based on a change in log of the incidence rates, and that could potentially contribute to the interpretation would have been based on the percentage change in incidence rates. Now we also changed that assumption, and we try to make that inverse hyperbolic sign growth rate, and we do find consistent effects based on our original findings. We also perform several other tests, especially heterogeneity test. And what we find is we do not find evidence of prior income inequality or unemployment rates having an effect on the incidence rates because of the stay-at-home order implementation. We, however, do find suggestive evidence that the stay-at-home order policies in higher GDP counties had lower COVID-19 rates than lower GDP counties. We do find very negligible effects across demographic characteristics, and we do that by race, elderly population, and prior social association rates, and the effects are very negligible in terms of this heterogeneity. In terms of the regional health, we do not find evidence, strong evidence. We only find negligible effects on the prior death rates or preventable hospitalizations and physician availability, and they do not seem to affect our variation. Finally, we also do a few tests with the census division because COVID-19 could have varying trends across different regions in the county. We try to address that potential issue by testing using different census division, and yet it yielded our results were consistent across those as well. So in summary, what we find is implementation of the stay-at-home policies is associated with about 2 percentage point reduction in daily COVID-19 incidence rates. And this is based on a cross-border county design, comparing without those counties without stay-at-home policy orders. And our effect sizes of 2 percentage point appear to be smaller when compared to the existing studies, but still our study design is meant to include only those states from Southern, Midwest, and mountain regions because only though we were able to test the control and treated group comparisons only among those states. And we would like to improve the generalizability of the estimates based on this ongoing incidence of stay-at-home policies. And with this, I conclude my presentation. And here's my contact information, and you can see the working paper, which could be downloaded from the SSR, and it's publicly available as well. Thank you.
So I'm going to step in here for a moment. I think Dr. Hicks is having a few computer problems, but I think excellent presentation, Srikant. Look forward to the Q&A, and there are a lot of questions already starting to build up, so I'm sure we'll have a great discussion. I'm going to just turn it right over to our next presenter, and then we'll have a discussion of both these pieces of research. So Erik Nesson from Ball State, why don't you tell us about your research in mobility, and look forward to hearing your remarks. That's all yours.
All right, thank you very much. And see, Srikant, let me see if I can share my screen. Okay, so hopefully you can all see my slides right now. So I'm Erik Nesson. I'm an associate professor in the Department of Economics here at Ball State University. And I'd like to thank AUBER for putting on this roundtable and inviting us to present, and Mike Hicks and the other people at SIBER for also inviting me to present my work. And before I start, I'd also like to say thank you to Srikant for his excellent and important paper presentation. So he's really using cutting edge techniques and providing some very important evidence about social distancing orders. And what we're doing in our paper is a lot more humble than what Srikant is doing. And this is joint work with a few other members of the Department of Economics at Ball State, Ma Young Fan, Phil DeSica, Min Wen, and Paul Niekamp. So some quick motivation for those of you who are not in the Midwest. You may not know that yesterday both Indiana and Ohio jointly announced that they will be requiring face masks for most Hoosiers in most public indoor settings. And this comes as both Ohio and Indiana have seen an uptick in COVID-19 cases over the past weeks. And, the question remains, how effective are these face mask mandates going to be? So you may be able to think of some reasons why these mandates may not be that effective. So when I go to a lot of indoor places, grocery stores, super centers, a lot of people are already wearing masks in those places. A lot of private businesses have been already requiring face masks sector, and some action by individuals of their own accord to wear face masks before this mandate went into effect. On the other hand, and there's always another hand, we're economists, on the other, a lot of people who were not wearing face masks for various reasons. So this mandate may have an effect and convince some people who would not otherwise have decided to wear face masks to wear face masks. And this relates to the question that we want to answer and investigate in our paper. So we want to investigate kind of the progression of the COVID-19 pandemic kind of in the first couple of months in the state of Indiana. So kind of some of the geography of when did it appear first and how did it evolve? And then we want to investigate the social distancing behavior of Hoosiers. So when did people start to stay home more, stop visiting different places, and were there certain events that seem to have affected those? So before I get more specifically into our research questions, I want to thank Safegraff, who provided the data for this project related to cell phone locations, and we're going to use that, as I'll describe more later, to kind of track social distancing behavior. So specifically, what we want to look at is we want to investigate how the COVID-19 pandemic evolved across the state of Indiana. So when did it appear, where did it appear, and how did it evolve? Then we want to look at social distancing behavior across the state and see were there differences in social distancing behavior by different characteristics of counties. So we're going to investigate urban versus rural counties. And then we want to look at whether there were specific events that affected social distancing behavior. And then finally, we want to look at kind of different points of interest and see where and when people started or stopped visiting those points. So to investigate the COVID-19 pandemic, we're going to use publicly available data, very similar, if not identical, to the data that Srikant is using. What we're going to look at is data that was compiled by the New York Times and is available publicly at the web address here. And it represents kind of county by day measures of both cases of COVID-19 and also deaths. So what I'm going to do is show graphs and maps of Indiana to show how the cases evolved over the course of March and April. So this first graph is from March 15th of this year, and it shows that there were very few cases around the state of Indiana. So move forward 2 weeks to the very end of March, and here again, there are very few cases. It isn't until mid-April, April 12th, that you can start to see some numbers of cases start to increase across the state. And then as of late April, you can see that there are definitely spots in the state that are seeing very high numbers of cases, and the pandemic is pretty widely spread across the state. I want to draw your attention to a few geographic areas of interest. So if you wanted to see where the capital of Indiana is, Indianapolis, that's right about here, and you can see that it is a lighter shade, which indicates that it saw higher per capita levels of cases. And indeed, it is by far the largest center of cases in the state. We here at Ball State are located in Delaware County. Generally, we have been spared some of the worst of the pandemic, and we have seen fairly low levels of cases. Your eyes are probably drawn to this yellow county right here. That is Cass County, and it is a relatively rural county. It has a fairly low population of about, I think, 40,000 people. The reason that it stands out is because there is a meatpacking plant there that saw a fairly large outbreak of COVID-19, and that led to a large outbreak in the county. So next we'll examine deaths from COVID-19, and I'm going to present this in largely the same way, show how deaths evolved across the state in the first month and a half of the pandemic. So starting in mid-March, this is March 15th, I think is one day before or maybe just after Indiana saw its first death from COVID-19. March 29th, 2 weeks later, deaths are still fairly low. It isn't until mid-April that we start to see death numbers creeping up, and then kind of like you see in cases, in late April, the number of deaths are more widely dispersed across the state. As with before, Indianapolis is a definite place where deaths from COVID-19 have been higher than in other places. And we here in Delaware County have seen fairly low fatality rates. There's, as there was before, one county that stands out for high deaths per capita, although interestingly, it is not Cass County, it is Decatur County, which, like Cass County, is a fairly rural county. Interestingly, there doesn't really seem to be any one event that drove the high fatality rates there. They do have a slightly older population, but I don't think anyone has really figured out why deaths in Decatur County are so high. Okay, so next we'll turn to examining the social distancing behavior of Hoosiers. So for this, we're going to use data which tracks cell phone locations from Safegraff. And what Safegraff does is they examine GPS pings from cell phones. And what they do is they determine the common nighttime location of each mobile device over a 6-week period, and they call that the device's home. And then they measure when devices leave their home, and we're going to take that and aggregate it up to the county level. And that's going to give us a measure of social distancing behavior at the county level. So what we're going to measure first is the percent of devices in each county that stay at home, or rather that leave their home every day. And that's going to be our measure, our first measure of social distancing behavior. What we're going to do next is look at visits to various points of interest. So here, Safegraff records when cell phones visit different points of interest, and they match those points of interest to NAICS codes so they can categorize these POIs into categories of stores. We're going to focus on kind of two broad categories. So first, we're going to look at stores, and we're going to look at gas stations and supercenters, which are like Walmart or Target or Costco, and then we're going to look at grocery stores. The second large category that we're going to investigate are more entertainment and recreational areas. So here again, we're going to focus on three. We're going to look at restaurants and bars and outdoor recreational facilities and RV parks. So this first graph here is going to track the progressions of Hoosiers staying at home. And we aggregated the data to the county level data into two groups of counties, urban counties and rural counties. And what you're going to see on the graph as I kind of reveal how things progress across the state is the black line with squares is going to represent urban counties, and the red line with triangles is going to represent rural counties. So starting in early March, we have the first Indiana COVID-19 case, and as you can see, there's not really much change in the percent of Hoosiers that are staying home in either urban or rural counties. But then once we have the first death in Indiana, you can see that all of a sudden, Hoosiers in both urban and rural counties start staying at home more. They stop leaving their house. And this progression continues. And interestingly, most of this behavior happens before Indiana put its stay-at-home order in place in fairly late March. And then if we continue onward for after that, we see that both urban and rural counties are staying at home much higher rates, but starting in mid-April, it seems like people started to get maybe a little bit bored and started to leave their house more often. A couple things that I wanted to draw your attention to in this graph are, first of all, it seems like there is an uptick in the percent of people that are leaving their home the day after the stay-at-home order. We don't know exactly why this is. It might be that more people left to get supplies at the grocery store. Maybe that people went out maybe one last time before staying at home. We don't really know. Another interesting thing is there does seem to be a difference in the response by urban and rural counties. So urban counties are more responsive to the COVID-19 pandemic in terms of staying at home than rural counties. This may reflect a difference in perceived risk of getting COVID-19, may reflect a difference in political attitudes. We don't really know. That remains an interesting question for others to look into. So the next thing that we did is, since we're at Ball State, we were interested in what happened in our home county of Delaware County. So this next graph shows the same progression as the graph before it, but one event that we were interested in particular is Ball State University deciding right after our spring break to move its classes all online. And you can see that event is outlined in red. Interestingly, there doesn't really seem to be much of an effect of that announcement on the overall behavior of Hoosiers who live in Delaware County. Again, it seems to be that first death in the state of Indiana that really seemed to drive social distancing behavior. So next, we're going to change the way that we look at social distancing a little bit, and instead of looking at the percent of people who are staying at home, we're going to look at visits to different points of interest. So first, we're going to examine shopping behavior. And as I mentioned before, we're looking at visits to 3 categories of establishments: gas stations and supercenters and grocery stores. So as we start off in early March, we can see that visits to these different locations are kind of moving along without very much of a trend. Interestingly, here we see that after the national emergency order goes into effect on March 13th, all of a sudden there's a big increase to these different categories of establishments. And what we thought was going on here was this kind of jolted people into thinking that they might want to stock up on different items, for example, toilet paper. So people ran out to these different categories of stores to stock up because they thought that they might want to prepare for what was coming ahead. Right after this, we see a decline in visits to these different establishments. And here again, a lot of this decline seems to happen before Indiana's stay-at-home order goes into place. So it seems, again, like Hoosiers were reacting to other factors proactively before the actual government mandate went into effect. So finally, we're going to examine visits to more entertainment type places. So as a reminder, we're going to examine 3 categories of establishments: bars, restaurants, and outdoor recreational facilities. So here again, we can see that visits to these locations drop quite a bit after the national emergency. And by the time the stay-at-home order goes into place, Hoosiers are largely avoiding these locations. You can see also that parallel to the data from showing the percent of people leaving their homes, starting in mid-April, people start to visit these places again. Here you can also see a large increase in visits to recreational facilities. That turns out to be right around Memorial Day. So it seemed like on Memorial Day, everyone decided that they should go visit their local state or national park, or they should take their RV and go camping. So to summarize kind of what we did here, the early spread of COVID-19 in Indiana didn't really happen until mid-April. It was fairly widely dispersed across the state, but definitely concentrated in a few select areas. And the same was true in deaths. And I think the most interesting thing that we find is that Hoosiers largely adopted social distancing behavior before the actual state mandate went into effect. So there seemed to be other factors that convinced Hoosiers that they should stay at home and stop going to restaurants and bars and stores as much. And those were separate from the stay-at-home order. And starting in April, even though the stay-at-home order was still in effect, people started venturing out a bit more again. And obviously, I think this has implications for what we're going through now in terms of mask mandates and whether or not we need to think about shutting down restaurants and bars, or what this holds for the future of school, both universities and school for younger kids. So again, I'd like to thank AUBER and SIBER for allowing me to present this work, and I will turn it over to Mike.
Thanks, Eric. I'm back with everyone. I just have a couple of questions before we get some from the audience. You spoke a little bit about this over the last few minutes, hinting at the policy implications, but could you sort of expand on what you would like a mayor or a governor or a state health department to take away from what you've done here?
So I think that is such a good question. And what I've taken away from this study, and also just kind of examining and being a citizen through all of this, is that the messaging and kind of the leading by example that policymakers do seems to be at least as important as actual laws that are put into place. And one of the things that I've really appreciated about our governor in the state of Indiana is he has really, I think, done a good job of leading by example and providing a lot of guidance to Hoosiers on good public health things that we can all do to stop the spread of COVID. And I think in the state of Indiana, we've seen relatively low numbers of cases compared to some other states. And our recent uptick in cases, I think, has been lower than some other states. And I think some of that can be attributed to not just the state mandates on staying at home, but the guidance that has come from both the governor and other public health officials.
I'm going to ask a quick follow-up to that. When I first read what you had, one of the things that occurred to me was the presence of or the rural-urban differentials that you talked about. And it seems to me that one of the things that the governor did fairly early, which I thought was unusual, was a big publicity campaign. Do you think there's a way to identify whether or not there was penetration of those communications into the locations that you were measuring here? In other words, could you use a Facebook and track ads, or could you look at the coverage of TV or radio advertisements that the governor had made to identify whether or not there was actually a marketing effect in this? I mean, you've hinted at the role of people, but had you thought about what that might, what you might be able to do in the marketing side to evaluate that public policy?
So some of that goes beyond my level of kung fu in terms of being able to evaluate Facebook ads. Maybe Srikant, maybe that's your level that you might be able to look at that. I think that is very important too. I know there's been some work on, in a different way, evaluating messaging that people are getting from different cable news channels and how that affected or did not affect people's social distancing behavior. So to the extent that the announcements were playing in different venues, you might be able to try and connect who's looking at which social media platforms and how their behavior was affected. But that, if it's possible, that would certainly be a very important study to conduct.
Well, if I may, my last question, since my computer blipped in and out with construction here at Ball State. Srikant, I wonder if you could, do you think what you've done, you talked, I could hear a little bit about the policy component of your discussion, but how do you think your work and Eric's could be combined to sort of, if both of you were sitting in a staff room with the governor, what would you try to say the synthesis of these two works might be? in terms of their next policy steps?
That's a great question. So our study, we try to find, there are several studies out there that talk about the effect sizes. So when we talk about these policies, one thing we need to caution the policymakers is if there are any studies that talks about the upper biased estimates, that actually probably could create some kind of a significant diffidence among policymakers, and any downward biased estimates potentially could actually increase overconfidence and premature opening of economy. So our study actually fits right in between to say, to give as robust as possible the models and trying to get the identification strategy as, still there may be many assumptions that goes behind the scenes of these models too, but technically with what data we have, we try to experiment that possibility. And even though the effect sizes are 2 percentage point down, decline in rates, that would be a stepping stone to decide whether, in terms of partial reopening, how the social distancing measures are going to be impactful. So Erik's work is actually in line with what my work would be in terms of whether or not should we implement another stay-at-home policy to reduce the incidences in the near future when wave 2 COVID goes up. Now, the another policy question would be, okay, if so, at what cost? At what economic cost is that going to happen? So that's the room for agreement in terms of what other policies would fit best. That could potentially, the ultimate goal is to reduce social distancing at the current scenario.
Thank you. I thought the same thing. I mean, these are two very complementary studies. And I'll just throw it out to the audience. If you have a question on chat, if you throw it my way, I'll read it off for either one of these scholars to try to answer questions about their work. And I'll just give that a minute.
So while that's happening, I saw that Pat had a question for both of us, to Srikant about testing capacity and to me about the seasonal data. So see, I can answer about the seasonal data first. There might definitely be seasonal patterns in visits to these different locations. I would expect that some of those seasonal patterns would play out a little bit over a little bit longer of a time horizon and not be quite as abrupt as we saw in our data. So there definitely are probably some seasonal trends that are pushing our changes in social distancing visits to these different points of interest in one way or another. It's not obvious to me which direction those would go necessarily. And also, if you, along those same lines, if you go back and look at our data, you can see strong day of the week effects to visits to our different points of interest. So, if they're day of the week effects, they definitely suggest that there might be seasonal effects as well.
And Pat, about my question to me, where you're asking about what would be the effect of increased test capacity on incidence rate growth, and is this capacity heterogeneous? That's a great question. So obviously there are measurement bias in terms of these COVID cases or COVID counts, right? So technically there will be variation in availability of testing facilities, or it could be daily testing capacities, or even presence of asymptomatic carriers. I maybe have COVID, but I don't. If I tested, then I would know that I had COVID or not. So, and what happens in this methodological design, so we can assume that both the border pairs, the match pair counties, also would have increased this test capacity that would have been unobserved to begin with. So since we control for the match pair fixed effects, we hope that bias may not exist. It's not. It's kind of a systematic error across all the borders and across the nation. So that's how we try to. Even if there are any bias, it could potentially bias downwards.
It's also harder to get data on the actual number of tests that are performed. So Srikant, if you have that data, you could maybe look at the percent of the tests that come back that are positive. That's one thing that I've done in another paper. Or you could also try and look at just whether the number of tests that are performed seem to show differential trends after these stay-at-home orders go into place. That might be one way that you could address that concern. But again, that data is harder to come by, so that may not be something that's possible for you.
Thank you.
I'm going to make a last call for any questions from the audience. We're not seeing any, although if you pop up while I'm, before I turn it over to Pat, we'll certainly ask the questions. I'd really like to thank both Srikant Devaraj at Center for Business and Economic Research and Erik Nesson of the Department of Economics and BER. Both of you have produced what I think are outstanding pieces of technical work and policy relevant work in fairly short notice during a pandemic where both of you have been working at home with balancing small kids and a ton of other challenges. I appreciate you presenting this work for us, sharing this with us here at AUBER at a time of immense policy debate over the appropriate steps, both governmental and non-governmental, to address the ongoing COVID crisis. This is the type of public service that I think we at Ball State like to tout amongst ourselves, and I really appreciate the opportunity for AUBER to present this. This was a great idea, Pat, and to the rest of you at the AUBER conference. We're thinking about going to the AUBER conference. This is the quality of work that you can expect, including a lot of forecasts and other work. And so with no more ado, I'll turn it back over to our president, Pat Barkey, and thanks from the team at Ball State University for presenting this work here today.
Thank you, Mike. Thank you, Srikant and Erik, presentations. Thank you to the audience for taking the time to tune in. It's been our pleasure to bring this to you. And I would also like to thank Brian Lewandowski and Shannon Furness. Brian is at University of Colorado Boulder, and Shannon Furness is our membership consultant for our association. Thanks for joining us. Have a great rest of the week. Stay safe and stay healthy. So long.